Did you know that some babies decide to make their grand entrance a little too early, often without any warning? This is called preterm labor, and it's when a baby is born before 37 weeks of pregnancy. It's actually more common than you might think, affecting millions of families worldwide. The good news? Being aware of the early signs can make a world of difference, allowing you to act fast and protect both yourself and your precious little one. So today, we are going to dive deep into the 7 early signs of preterm labor that every expectant parent absolutely needs to know. We'll also cover what to do if you spot them, and how you can reduce your risk. Stick with me, because this information is crucial for a healthy pregnancy journey. Before we jump into the signs, let's quickly understand what can cause preterm labor. Think of it like a puzzle with many pieces. Sometimes, the cause is linked to your medical history, like if you've had a preterm birth before, or if you're carrying multiples like twins or triplets. Certain health conditions can also play a role, such as high blood pressure, diabetes, or infections, especially in the urinary tract or gums. Other times, the issue might be with the pregnancy itself. Problems with the placenta, like placenta previa, where it covers the cervix, or an unusually shaped uterus, can trigger early labor. And let's not forget about stress. Both physical and emotional stress can be major contributors. Lifestyle factors are also important. Things like heavy physical labor, smoking, drinking alcohol, or not getting enough prenatal care can significantly increase the risk. Sometimes, though, preterm labor happens to moms with no known risk factors at all, which is why it's so important for everyone to be vigilant. Alright, now let us get to the core of our topic, the 7 early warning signs you should never, ever ignore. First up, regular contractions before 37 weeks. Now, you might be thinking of Braxton Hicks contractions, which are normal practice contractions, but preterm labor contractions are different. They're more consistent and regular. Your belly will tighten up, and it might feel like a firm band across your abdomen. This can happen with or without pain. If you notice these tightenings happening every 10 minutes or more frequently, it's time to pay close attention. Try lying down, drinking some water, and timing them. If they don't stop and continue to get closer together, stronger, or more regular, that's a big red flag. The second sign is lower back pain. We all know pregnancy comes with its fair share of aches and pains, especially in the back. But the back pain associated with preterm labor is different from the usual muscle strain. It's often a dull, persistent ache that you can't seem to get rid of, no matter how you sit or lie down. It might also come and go in waves, kind of like menstrual cramps, but located in your lower back. If you're experiencing a new or different kind of back pain that just won't quit, don't just brush it off as a normal pregnancy symptom. Sign number 3 is pelvic pressure. This can feel like your baby is literally pushing down on your pelvis or vagina. It's a feeling of heaviness or fullness in that area. Some women describe it as feeling like they need to have a bowel movement. While it's normal to feel some pressure as your baby grows, a sudden increase or a constant, uncomfortable pressure before your due date could mean the baby is descending into the birth canal too early. It's a subtle but important signal from your body. Next, let's talk about the 4th sign, a change in your vaginal discharge. During pregnancy, it's normal to have more discharge than usual. But what you need to look out for is a significant change. If your discharge suddenly becomes watery, like a slow leak, or if it turns into a mucus-like substance, sometimes called the mucus plug, that's a warning. It could also have streaks of pink or brown blood in it. This is often referred to as bloody show and can indicate that your cervix is starting to change in preparation for labor. Any unusual discharge warrants a call to your doctor. The 5th sign is abdominal cramps. These can feel a lot like menstrual cramps. You might feel them low in your abdomen, and they can be constant or come and go. They might also be accompanied by diarrhea. It's easy to mistake these for gas or indigestion, especially if you've eaten something new. But if you're having persistent cramp-like pains that feel different from the usual round ligament pain, and they don't go away with rest, it's a sign to take seriously. Our 6th sign is a very clear one: fluid leakage from the vagina. This could be a sudden gush of fluid or a slow, steady trickle. This is what's commonly known as your water breaking. If your amniotic sac ruptures before 37 weeks, it's called preterm premature rupture of membranes, or PPROM. This is a serious situation because it increases the risk of infection for both you and your baby, and it often leads to preterm labor. If you suspect your water has broken, don't hesitate. You need to get to the hospital right away. And finally, the 7th sign is spotting or light bleeding. Any vaginal bleeding during the 2nd or 3rd trimester is not normal and should be evaluated immediately. Even if it's just a small amount of spotting, it could be a sign of a serious problem with the placenta or an indication that your cervix is starting to dilate. Never assume it's nothing. It's always better to be safe and get checked out. So, what do you do if you experience any of these signs? The most important thing is not to panic, but to act quickly. Don't try to self-diagnose or wait to see if it goes away. Call your doctor, midwife, or your hospital's labor and delivery unit immediately. Be prepared to tell them exactly what symptoms you're having, when they started, and how often they're occurring. Early intervention can make a huge difference. If you get to the hospital early enough, your healthcare team might be able to stop or delay labor. This could involve simple things like bed rest and drinking lots of fluids to rehydrate. In some cases, they may give you medications to relax the uterus and stop contractions. They might also give you a steroid injection, which helps your baby's lungs mature faster in case they are born early. Every extra day or week your baby can stay in the womb is incredibly beneficial for their development. Of course, the best approach is to try and prevent preterm labor from happening in the first place. While you can't control every risk factor, there are many things you can do to have a healthier pregnancy. First and foremost, go to all your prenatal appointments. Regular checkups allow your doctor to monitor you and your baby closely and catch any potential problems early. Maintaining a healthy lifestyle is also key. Eat a balanced diet rich in fruits, vegetables, and whole grains. Stay hydrated by drinking plenty of water throughout the day. If you smoke or drink alcohol, it's crucial to stop. These habits are strongly linked to preterm birth and other complications. Managing stress is also important. Find healthy ways to relax, whether it's through prenatal yoga, meditation, gentle walks, or talking to a friend or therapist. And always listen to your body. If your job involves heavy lifting or standing for long periods, talk to your doctor and employer about making adjustments. Remember, every pregnancy is unique. What's normal for one person might not be for another. That's why it's so important to be in tune with your own body. If something feels off, trust your instincts. You know your body better than anyone. Don't ever feel like you're being overly cautious or bothering your doctor. They are there to support you, and they would much rather you call about something that turns out to be nothing than have you wait too long with a serious problem. Let's do a quick recap. Preterm labor is a serious condition, but knowing the warning signs can empower you to act fast. Be on the lookout for regular contractions, a dull lower backache, pelvic pressure, changes in vaginal discharge, abdominal cramps, any fluid leakage, or spotting. If you notice any of these, call your healthcare provider right away. Your quick action could give your baby the extra time they need to grow and develop safely. Stay informed, stay vigilant, and always prioritize your and your baby's health. I hope this video has given you the confidence and knowledge you need to navigate your pregnancy more safely. If you found this information helpful, please give this video a thumbs up and consider subscribing to our channel. We're dedicated to providing you with reliable, supportive content to guide you through every step of your pregnancy journey. Thanks for watching, and take care.